I was looking through the material you sent on high blood pressure and vision, and it really struck me. Did you realize that this condition, often totally silent, could be slowly, well, taking away your sight without any pain or obvious warning signs?
It's a sobering thought, isn't it?
Hmm.
Uncontrolled high blood pressure or hypertension is definitely a serious threat to vision.
Oh,
And the fact that it's so insidious that the damage can happen gradually without symptoms makes it particularly dangerous.
exactly. So for this deep dive, we're going to explore the insights from that YouTube script, How High Blood Pressure Can Lead to Vision Loss, which itself draws heavily from Dale Ruddock's book, Lowering Blood Pressure Naturally.
Right.
And our mission here really is to understand how this damage happens, why it's such a major concern, and maybe most importantly, what practical steps you could actually take to protect your eyesight.
And I think what's really fascinating is how it highlights the body's interconnectedness. The health of these tiny blood vessels in the eyes can actually tell us quite a bit about our overall cardiovascular health.
Okay, let's get right into that connection then. How does high blood pressure actually, damage the eyes? What's the mechanism?
Well, it all comes down to the network of tiny, very delicate blood vessels in the eye, specifically the ones feeding the retina.
The retina, that's the light-sensitive part at the back, right?
Exactly. It captures the images you see and sends signals to your brain. Think of these blood vessels like microscopic pipelines delivering essential oxygen and nutrients.
Okay, tiny pipelines. So what happens when the pressure inside those pipelines gets too high and stays high, like with hypertension?
Right, so consistently high blood pressure puts excessive force on the walls of these very fragile vessels. They just aren't designed for that kind of constant pounding.
Hmm.
Over time, this pressure can make them narrow, weaken. They can even start to leak fluid or blood. And the high pressure can also cause the vessel walls to thicken, making them less flexible and more prone to blockage.
And there's a medical term for this specific damage to the retinal vessels, isn't there?
Yes, that's what doctors call hypertensive retinopathy. It's the direct consequence of those delicate vessels being damaged by sustained high blood pressure.
So hypertensive retinopathy, if that's happening, what might someone actually notice? What are the symptoms, the consequences for their vision?
Well, initially it might be subtle, things like slightly blurred vision or maybe seeing new floaters or spots drifting around.
Okay.
If the pressure actually causes bleeding inside the eye, that can lead to more significant vision problems. And in more advanced cases, you can get swelling of the optic nerve.
The optic nerve, that sounds serious. That's the main connection to the brain, isn't it?
It is. It's the critical pathway.
Yeah.
And swelling there is a major red flag.
And the worst case scenario, the outcome that really drives home why this is so important.
Unfortunately, yes.
Yeah.
In severe, long-standing cases, hypertensive retinopathy can cause permanent vision loss, sometimes even complete blindness. The retinal damage can reach a point where it's, well, irreversible.
Wow. Irreversible.
And what's really telling is that studies show the severity of this eye damage, the retinopathy, actually correlates with the risk of future heart attacks or strokes. So the eye exam isn't just about vision. It's a window into your whole vascular system.
That's a powerful point, a window into your overall health. And like we said, this damage often creeps up silently, no warning signs. It's almost a paradox, isn't it? Something so precious like sight being under threat without us even knowing.
It really is a paradox, and it underlines why proactive health checks are just so vital, because those early stages often have zero symptoms, regular eye exams, and blood pressure checks become absolutely crucial.
It makes you think, if this is happening in the tiny vessels of the eye, what else might be going on? In the heart, the kidneys, the brain, places that also depend on healthy blood flow.
Precisely. The potential for irreversible vision loss is worrying enough on its own. But yeah, zooming out, these changes in the eye can absolutely be an early warning sign, a signal that there might be similar damage happening silently in other vital organs.
So those little changes in vision you might brush off. Need new glasses, maybe. They could potentially signify something much bigger going on with your blood pressure systemically.
Exactly right. Think of hypertensive retinopathy as a potential canary in the coal mine for your cardiovascular system. It really highlights that deep connection between overall health and eye health. It kind of makes you ask, are we listening to those subtle signals our body sends?
Okay, the risks are clear. Let's shift to the positive. What can people actually do if you have high blood pressure, or even if you just want to be proactive? The source material lays out 4 key actions, starting with the most obvious one: controlling blood pressure.
Absolutely fundamental, yeah. Bringing blood pressure down into a healthy range
Mm.
is the single most important thing you can do. It reduces that constant strain on the eye's blood vessels.
And does it have to be a huge drop to make a difference? Not necessarily. What's encouraging is that even, relatively small, consistent reductions in blood pressure can be significantly protective. It can slow down or maybe even halt further damage. It's about aiming for that healthier range consistently.
Okay, step 1, control the pressure. Step 2 was regular eye exams. Why is that so critical if you might not even have symptoms yet?
Well, your eye doctor uses specialized tools like an ophthalmoscope to look directly at the retina and its blood vessels. They can often spot those early warning signs of hypertensive retinopathy long before you'd ever notice a change in your vision yourself.
Ah, so they can literally see the damage starting.
Yes, exactly. These exams offer a unique, non-invasive view of your microvasculature. Skipping them means potentially missing that crucial early window where intervention is most effective.
Makes sense, like getting an early warning system check. Action number 3 is adopting a heart-healthy diet. How does food tie into eye health and blood pressure? Well, it's all connected, isn't it? What's good for your heart is generally good for your eyes, too. A diet high in sodium, for instance, can push blood pressure up. So cutting back on processed foods, added salt, that's key.
Right.
And on the flip side, eating more leafy greens, things rich in nutrients and antioxidants, supports overall blood vessel health. And don't forget hydration. Drinking enough water helps maintain good blood flow. Think about things like the DHH diet. That's a well-studied example.
Good tips. Okay. And the fourth step mentioned is making natural lifestyle changes. What sort of things fall under that?
This is really about the bigger picture of well-being. Regular physical activity huge exercise is proven to help lower blood pressure naturally. Then there's stress management. Chronic stress can definitely contribute to hypertension, so finding ways to manage it, like mindfulness or yoga, can help. And good sleep. Don't underestimate quality sleep. It plays a big role in regulating blood pressure.
So it's the daily habits, really, like aiming for, 30 minutes of exercise most days?
Yeah, something like that. Moderate activity most days of the week can really add up and make a difference to your overall cardiovascular health, including those vessels in your eyes.
Now, the source material also brings in a personal angle from the author Dale Ruddock. He talks about his own diagnosis with high blood pressure.
Yes, it sounds like his personal journey was quite impactful. He mentions initially thinking, oh, I feel fine, which, as we've been discussing, is so common with hypertension because it is often silent. That realization seems to have been a real motivator for him.
A wake-up call, yeah. And that led him to write the book, Lowering Blood Pressure Naturally. Sounds like he wanted to share what he learned.
Exactly. The book is framed as a practical, sort of step-by-step guide, not just about lowering blood pressure, but specifically about protecting the organs most at risk, eyes, heart, brain, kidneys, using natural approaches.
So it's positioned as a resource for people looking to take a more proactive and natural route.
Precisely. It aims to bridge that gap between knowing the risks and actually having concrete strategies you can implement in your daily life, rooted in his own experience, which often makes advice more relatable, doesn't it?
It really does. So as we wrap up this deep dive, it really hammers home just how incredibly valuable our vision is, something we maybe take for granted until it's threatened.
Absolutely.
Yeah.
And if there's one key takeaway, it's the importance of being proactive. Like the source material stresses, please don't wait for symptoms, don't wait for pain.
Because by then,
Some irreversible damage might have already occurred.
So the clear message for you listening is prioritize managing your blood pressure. Do it now for the long-term health of your eyes and really your entire body.
Definitely. And maybe it leaves us with a final thought to ponder. If a condition as seemingly quiet as high blood pressure can silently cause such profound damage to our sight, what other aspects of our health might be operating under the radar? What else warrants our attention, our proactive care, even if everything feels okay on the surface? It's a good reminder to look deeper.